So this is that hip reset exercise that we talked about in clinic. So what's going on is the head of the femur inside of the socket of the acetabulum is in theory malaligned. So that deficit is the hip joint itself. We're not working on any muscle or tendon or ligament. We're trying to get some sort of a change or a shift going on inside of the ball and socket joint. So for this exercise, what we're going to do is we get into the lunge position. We're working on the down leg here. You're going to squeeze your glute to kind of push your pelvis forward, keeping your shoulders over your hips. So we're not leaning forward or leaning backwards. We're just in this nice neutral position. Push that head of the femur forward inside of the ball and socket joint. So every time I squeeze that glute, I'm trying to focus on what do I feel deep in the joint, feeling that head of the femur shifting forward as I contract my glute muscles. Now naturally you'll feel some sort of a hip flexor stretch. You'll feel a contraction back here. You might feel some back tightness. You might feel like you're pushing your body forward. But again, it's just a nice strong contraction of the hip. Theorizing, visualizing, pushing that head of the femur forward as you contract that gluteal muscle. Right? So now you don't do this for a static hold by any means. It's the repetitions that matter. So you squeeze, you go pressure on, off, pressure on, off, pressure on, off. Sometimes with the up leg, I'll dig my heel into the ground a little bit just to help kind of set my pelvis and maintain stability. The less motion that you get with this movement, the better. Again, we're working on the hip, ball and socket joint. So if I'm moving everywhere else, I'm taking pressure off of the joint itself and I'm not getting the reduction that I'm looking for. So less motion is better for the rest of your body. Squeeze that glute, push that femur forward. And then we talked about messing around with the positions of rotation at the hip. So for you right away, we set up in like a relative internal rotation. So internal rotation at the hip, your ankle is outside of your hip joint. From alignment, and then squeeze, pressure on, pressure off. You can mess around and do neutral or even external rotation for this exercise. Sometimes patients need that. Again, you're just taking that head of the femur inside of the acetabulum. When you do that internal rotation, you're rotating it this way and then pushing forward. External rotation, you rotate it this way and then push forward. That hip is a three-dimensional joint. That rotation piece helps kind of address whatever limitations that present. So you sit there, you pressure on, pressure off for 10 to 15 repetitions, a couple of times a day, and you should notice that your symptoms are resolving or at least calming down.